Hello, my name is Stony Fox, and I'm going to be doing a presentation on alcohol addiction. The outline for today is going to be what is alcohol, how do people get addicted, what are the standard treatment plans, and what is social workers' role in helping. What is alcohol? Alcohol is a chemical compound that is primary ethanol that is found in alcoholic beverages. Common types you might see are beer, wine, and liquor, which is commonly known as spirits. Alcohol is made through fermentation of sugars or yeast or distillation. This is categorized as a depressant as it affects the central nervous system, creating a buzz, which can slow down and affect the coordination, judgment, and reaction time, causing impairment from drinking from large amounts. People commonly drink alcohol in social settings, use it in cooking, and is even used in medication. If overconsumptions happen, it can lead to alcohol poisoning, accidents, and dependency, though some research suggests that there is a moderate drinking can have some health benefits. How people get addicted. Alcohol activates the brain reward system, which releases pleasures, dopamine releases, and this can also reduce stress and negative emotions, which reinforces drinking behavior as well. Repeated use can lead to a higher tolerance, requiring more alcohol for more of the same effect. Which that means if you were to drink 4 beers regularly for like 6 to 7 days in a row, then you're probably going to need 5 to 6 beers a day to get the same effect that you had from the 4 beers. Withdrawal syndrome is also a part of addiction. It can cause anxiety, irritability, emotional pain, which can further drive the drinking habits. Habits can shift from drinking from choice to compulsion over time, which means that when alcohol use disorder is or alcoholism starts to happen, you go from the choice of like choosing do I want to drink or not to oh, I'm craving a drink, I really need to have one right now. Brain changes impair impulse control and decision making, which this can come from the anxiety, irritability, also it can go from pleasures from the endorphins being released as well, which can cause like you are invincible, you're on top of the world, which can cause you to make rational decision makings and can cause you to make rational impulse actions that can make quitting very difficult. Alcohol use disorder is a medical condition where alcohol use causes significant impairment or distress. There is 3 levels. There's moderate, which is 2 to 3 symptoms, moderate 4 to 5, and severe 6 and up. There's 12 syndromes that therapists and social workers and doctors can use to help identify the different levels of alcohol use someone is on. Some of the syndromes are inability to control drinking, craving and urges to drink, neglecting responsibility due to alcohol use, and withdrawal syndrome when not drinking. There is an addiction cycle as well. There is 3 stages. The first one being binge intoxication, where alcohol triggers brain reward system, reinforcing the use. This is where the pleasure and dopamines are released. The withdrawal negative effect, anxiety, irritability, emotional pain drive further the drinking. And then the anticipation, which is the craving and impaired impulses that can cause the habit shifting from the choice to the compulsion we were talking about, which can impair impulse control and decision making, making quitting difficult. What are standard treatment plans? Behavioral treatment can be seen as counsel-based approach to change drinking behavior. Cognitive behavioral therapy is very common. It is like a one-on-one therapy where it identifies the triggers from where the addiction started and what can trigger their unhealthy coping skills and can eventually build new ones for them to use to have better coping skills in the future. Motivational enhancement therapy strengthens motivation for change. There's also family couples therapy, which can improve support systems and relationships for the person who is in recovery. And then the 12 steps, that's a very popular one that encourages participation in peer support groups. You can see this as AA, where there's sponsors, where there's usually like the mentors that help people get through the recovery of addiction. Lets them have a community where they can feel like they're not as alone in their addiction, and it does help with less of a relapse in the future for people as well. What are standard treatment plans? Again, there's outpatients, there's regular visits with provider for therapy and medication, there's intensive outpatient and partial hospitalization. This is a more structured, and frequent session is going to be a tighter, more strict outpatient treatment. There's going to be residential treatment. This is usually rehab, rehabilitation care, where it's 24-hour living facilities. There's also inpatient treatments. This is usually the beginning of recovery from addiction, where there is supervised detox from withdrawal syndrome and stabilization. There is also medications used for alcohol use disorders. The FDA do have some approved non-addictive medications to help reduce cravings and pleasures from alcohol, ease withdrawal syndrome, and cause unpleasant effects when alcohol is consumed. These medications can be a really good way to help people get through their addiction recovery, and can help them not relapse after the treatment is over as well. How social workers help with alcohol use disorder. Assessment and screening is to evaluate the substance use and mental health history and triggers to determine treatment needs. Treatment planning is developing personalized treatment plans, coordinate services, and navigate healthcare systems. This is very important. Social workers need to have a development personalized plan, because not every person who is an alcoholic or has alcohol use disorder is gonna have the same treatment plan. This is where providing individual, group, or family therapy to support recovery is very essential. Not only is it important to give therapy to the person who is dealing with alcoholism, but to the family, for the family as well, as they are supporting the person through the recovery. Case management is very common. It helps track treatment progress, schedule appointments, and ensure compliancy with treatment requirements as well. Advocacy is super important, because clients, there should be support in clients' rights, assist in decision making that is best for them, and promote policies for treatments as well. Family support is to educate and guide loved ones on addiction and how to support recovery. Crisis intervention secures emergency services, assists in hospital admissions, and provide education on overdose responses. Which this would be like alcohol poisoning and stuff like that. Continuing education is very important for social workers as well, and this can definitely help with alcohol use disorder and alcoholism. Staying up to date on new treatment plan approaches and best practices for effective service delivery is very essential for social workers to stay up to date on the best treatment for the best personalized care plan they can have for their patient. And then housing and recovering support is very important as well. Having a healthy environment for someone who is dealing with addiction can lessen the likelihood of relapsing, and having housing for homeless people or for individuals of families as well can allow for a better, stable environment for them to be able to go through the recovery steps. These are some of the resources, these are all the resources that I used in my presentation, for my photo, and for the information that I have today. Thank you so much for listening. This presentation was very educational on what is alcoholism or an alcohol use disorder, and how I can use this in a social work setting in the future.